Hello and welcome to Opt to Thrive, episode 52. Swollen legs, the difference between lipoedema, lymphedema, and excess weight.
Welcome to Opt to Thrive, your go-to podcast for women's wellness in midlife, designed to educate, support, and inspire you to live your very best life. And now your host, Dr. Karina Sims.
Wow, what a spectacular day it is today. We're coming into autumn, still having a little bit of warm weather. We've gone through some rainy days and the figs are bursting. I think we're going to be picking figs for the next month, which I am absolutely loving. One of my absolute favorite things to do is to go for a walk in the morning, and on the way back, I go through the fig trees and pick out a few nice, plump, juicy, fresh figs right off the tree and pop them in my all-bran cereal, which is my little trick, along with little psyllium husk, of getting my fiber right off the bat in the morning. Not all of it, but a big bulk of it, which is great. In case you haven't got that message, fiber is one of the most evidence-based nutrients that we've got. Amazing for your gut, amazing for your heart and your blood sugar, all of those things. So if you're not watching your fiber, it's one thing that I would definitely recommend that you're looking at. If you're under 50, then 25 grams of fiber a day is the recommendation. And if you're over 50 or past the menopausal kind of period, then even higher is better. I aim for about 35 grams a day. And it's amazing. If you're curious about how much fiber you are getting in your diet and you're not sure how to work that out, there's a couple of ways. There are different kind of calorie counting apps that will also give you things like fiber and protein. So MyFitnessPal, I get no money for telling you this, but that's the one that I use and lots of people that I know use. It's very easy. And I can also pop a little free resource into the show notes, a list of common foods with their fiber content that you can download and maybe pop on your refrigerator as a quick little guide, a little cheat sheet. So you too can be making sure you get enough fiber in your diet. Meg, still over there in the thick of what's happening over there in the Middle East. I'll be really happy when that's all over. She, don't mean to brag, I've always had very good sleepers with my kids. But this is one of those times, maybe that's not so great. She was saying recently that she slept right through 3 of those alarms that come on their phones that say, seek shelter, the missile attack is imminent, or something to that effect. And she slept right through 3 of those, and then she woke up the next morning to a group chat about what had been happening overnight. And apparently there were missiles being intercepted right outside her window and shaking the building. And she slept right through it. So, probably not a great time to be an amazing sleeper. But when they were babies, both of my children were like that. A tree fell on our house once during a storm. It took out the side of the house, part of the side of the house, the roof. It took out my car. It literally fell right down almost through the middle of my car and totaled it. The SES were out there middle of the night with their sandbags and their chainsaws and the storm, and the kids never woke up. Amazing. But anyway, we probably need to get on with the show today. Today's topic is maybe a little bit different than some of the things we've done before. And it came about as a result of a chat I was having recently with one of my Reset members. She was telling me about her legs. She has a lot of pain in her legs, and she was sharing with me that she felt a bit self-conscious about her legs, about how they look. And she wondered if she could have something called lipoedema. So as we chatted about this condition, we both thought, what a great topic this would be for the podcast, because it's something that really is not well known. Not a lot of people know about it. And really myself, I hadn't really known much about it until the last kind of few years. And so I suspect that many of my listeners probably have not heard of it either. And it turns out almost always that this condition, with some rare exceptions, primarily affects women. So for this reason alone, I thought it would be worth bringing it to the podcast, and also to bring some awareness to the condition, what it is, how you know if you've got it, and what can be done about it. So today we're going to break down lipedema, and in particular, the differences between lipedema and lymphedema and just having excess weight from normal fat or adipose tissue. So if you have issues with swollen legs, this episode might be of interest to you for lots of reasons. Could that swelling actually be lymphedema or lipedema, or could it lead to something like lymphedema or lipedema? Now, first, I need to say that if you do struggle with swollen legs or a leg, especially if it's new and it just kind of came up overnight for no obviously good reason, like you haven't rolled your ankle or something, then you really do need to get this checked out by your doctor because there can be some serious causes. But today I'm going to talk more about chronic leg swelling that still should be checked out with your doctor. But lipedema in particular, as I said, isn't a really well-known condition, and it's often misdiagnosed. So I really wanted to kind of compare and contrast it against other conditions that it could be confused with. Now, the most common cause of chronic leg swelling involving both legs is chronic venous insufficiency. Essentially, this is when the veins can get a little bit leaky. This can be related to having a family history of this condition, from lack of exercise, having a previous leg injury or some kind of trauma. It can be related to prolonged sitting or standing, being overweight, being or having been pregnant, or even smoking. So chronic venous insufficiency is at the top of the list, and then further down the list, we find the two that we're going to focus more on today, lymphedema and lipedema. So let's start with lymphedema, because lymphedema is the more common condition of the two. Lymphedema is swelling caused by leakage of lymphatic fluid from the lymph system into the surrounding tissues. It usually occurs in the arms or the legs, but it can also be in the neck, the trunk, breasts, or genitals. Some people, less commonly, can be born with congenital or genetic defects in their lymphatic system that causes lymphedema, but most cases are caused by something else, something that has caused damage to the lymph vessels or the lymph nodes, like often following cancer treatments where lymph nodes have been dissected, or surgeries like a knee replacement, or after having your veins stripped, or having a DVT, a deep vein thrombosis in your leg. Or it can just be after some type of trauma or infection, and it can also be related to obesity or immobility. The condition can develop even years after what caused it has happened. It can be mild all the way to severe, and it can trigger inflammation and fibrosis. So there can be changes to the skin, which then increases the risk of getting skin infections, like cellulitis. If we want to tell the difference between the more common chronic venous insufficiency and lymphedema, there are a couple of things that might give us some clues. People with chronic venous insufficiency often notice that their legs get more swollen as the day goes on. But when they rest their legs by putting them up or elevating them, then they often see some improvement in the swelling. Lymphedema, on the other hand, doesn't really change throughout the day, or not much with putting your legs up. Also, with chronic venous insufficiency, the swelling doesn't affect the feet and toes, but the swelling with lymphedema does. In fact, there's a bedside test where we look for something called the Stimmer sign. The Stimmer sign is positive if you can't pinch the skin at the base of the second toe. It's negative if you can pinch the skin at the base of the second toe. So, if lymphedema has been present long enough, likely some months, it can cause fibrosis and skin changes, which then make it so that the skin is not pinchable at the base of the second toe. So a positive Stimmer sign. Now let's compare lymphedema to lipedema. Lipedema affects about 10% of women around the world, but what we know is that it's underdiagnosed. And as I mentioned earlier, it's often misdiagnosed, in particular as obesity or lymphedema. People with lipedema get abnormal, disproportionate deposits of fat, more commonly in the legs, but it can also affect the arms, and it usually spares the hands and the feet. Because it's fat, it can easily be misdiagnosed as obesity, and many women have been told that they need to lose weight, when in reality, they actually had these abnormal deposits of fat in this condition called lipedema. The diagnosis often doesn't get made for women until their late 30s to early 40s, but the symptoms are often present from their teens. It has just historically often taken that long to get a diagnosis. We don't know exactly what causes it, but there does appear to be a hormonal component, so the symptoms can often show up or worsen around periods of hormonal change like puberty, pregnancy, or even menopause. There are some clues that can help us make the diagnosis, and these are things that you should point out to your doctor if this is you. The tissue is often tender to press on. For instance, if you have lipedema in your arms, you might feel more discomfort than expected when you have your blood pressure taken. Having your blood pressure taken can be uncomfortable, but it shouldn't be painful. So that could be a sign. And people with lipedema may also notice that they seem to bruise easily. There are a couple of other clinical signs to look for as well. Because it doesn't typically affect the feet, the stemmer sign we talked about should be negative. You should be able to pinch the skin at the base of the second toe. Another sign is called the ankle cuff sign. This is meant to be a classic lipedema sign where we see an obvious, abrupt transition from the extra fatty tissue of the leg to the normal tissue of the foot at the ankle, which can create what looks like a little cuff in the skin. Now, if we compared lipedema to lymphedema, they would both be pretty consistent throughout the day and with position. So they are both different from the more common chronic venous insufficiency that we talked about, where the swelling tends to worsen as the day goes on and improve when you put your legs up. Lipedema and lymphedema don't really change that much with position or the time of the day. The stemmer sign is often negative in lipedema, so you can pinch the skin at the base of the second toe, but positive in lymphedema, so you can't. So that might be a clue to tell us the difference. Now, I say often because with almost everything, there can be some overlap of conditions, which can then make the diagnosis even more complicated. So we're talking generally here. And in fact, a saying in medicine is that patients don't always fit the textbooks. But how do we tell the difference between legs that are affected by obesity versus legs that are affected by lipedema, this abnormal deposition of fat? This is where the ankle cuff sign can come in handy because it's only present with lipedema, but not with obesity or lymphedema. Obesity and lymphedema of the lower limbs often both affect the feet and toes. So what can be done about lipedema? How is it treated? Well, it's not weight loss unless there's also obesity, and then the weight loss really only affects the obesity. But the weight loss will not improve these abnormal fat deposits, unfortunately. Compression garments and manual lymphatic drainage can help with the pain and some of the swelling. Aquatic exercise, so exercise in water, can help reduce pain and decrease the feeling of limb heaviness, and it can make exercise more tolerable for those with pain and tenderness. There is good evidence that it improves symptom control and quality of life, though it doesn't change the underlying abnormal fat distribution. Also, these people are at risk of skin infections, so good skincare is really important to prevent dryness and cracking. So avoiding soaps or irritants, using good quality emollients. And if these conservative therapies aren't enough to help manage the symptoms, then there are some surgical options available to remove some of those fat deposits. But that's at the pretty extreme end of things. And then, of course, given the pain and everything else that comes with this condition, psychosocial support's really important. Many people with this condition also suffer from depression. Unfortunately, lipedema is progressive. The pain, heaviness, and fatigue that's generally increase over time, which can then affect mobility, especially in the advanced stages. With time, the adipose tissue can become firmer and nodular and develop fibrosis. So then you might feel these thickened areas when you rub your hand over the limb. Swelling can become more pronounced and affect the lymphatic system, which then causes something called lipolymphodema. The treatment for lymphedema is similar with compression, manual lymphatic drainage, and good skin care. There is no definitive cure, and surgery is only really used for the most extreme cases. And again, if there is extra weight to lose, weight reduction is recommended, but it isn't going to reverse the lymphedema. So just to summarize, lipedema affects both legs or both arms and both legs, but it spares the feet and the hands. The tissue is tender and it may cause easy bruising. A positive ankle cuff sign can give us a clue that this is lipedema. Lymphoedema of the lower limbs involves the feet, is not tender. There are skin changes, and you can find a positive stimmer sign with lymphedema. Excess fat, to contrast against the other two, affects the feet, is not tender, and it doesn't cause skin changes. Now, if you're interested in hearing more about lipedema, I am very honored to announce that I have someone who has suffered from lipedema who has agreed to come on the show. We've got that interview scheduled in the upcoming weeks, so I really look forward to hearing all about her journey. I am sure that it will be an interesting story, and we are both very passionate about getting some awareness out there so that other women hopefully are not misdiagnosed and are not waiting until their 30s and 40s and beyond to be diagnosed with the condition, and it can be treated much earlier. And I suppose probably just as importantly, that they're validated in what they're experiencing, because as I said, a lot of these women are told that their legs are just fat and they need to lose some weight, which, as we've covered, isn't helpful. So watch this space. That interview will be coming soon. If you know someone who might be suffering from this condition, maybe pass the podcast along, and hopefully that gives them some information that they can then share with their doctor, which then might help them also get a diagnosis as well, and maybe some treatment that might be helpful for their symptom control. I also, before I go, I just want to thank everyone who has rated and reviewed the show. I really appreciate it. I love seeing the reviews, and I especially love when people reach out and share things with me. So keep that stuff coming. And if you have any ideas that you would like to see on the show, pass those along too. It's always fun. I love being guided to things that are going to be helpful. My aim is to provide the most value that I can to as many midlife women as I can. So spread the word, share the podcast. I hope you all have an amazing rest of your week. And until then, I hope you opt to thrive. Hey, before you go, if you're a midlife woman who wants to feel better in your body, whether that means improving your health, building strength and confidence, or working towards weight change in a kinder, more sustainable way, I have created something especially for you to support you. It's called the Midlife Health and Body Reset Kickstart Guide, and it's a free 7-day foundations guide to help you understand what's going on in your body in midlife and what actually makes a difference from here. You can download it using the link in the show notes. And if you're ready to take that work to the next step and you would like some personalized support to make it work, I run a 12-week midlife reset program where we work together on body recomposition, so losing body fat while regaining muscle, the absolute best thing we can be doing in midlife to combat midlife metabolic convergence. You get a custom strength training program from an exercise physiologist, weekly coaching with me, personalized nutrition guidance, and accountability to help you actually follow through. If that sounds like what you need, head on over to optothrive.com to find out more about the program and maybe even book a call with me to ask me any questions that you have, see if we're a good fit, and see if this program's for you.
The OptoThrive podcast is designed for information purposes only and is not engaged in the giving of medical advice. The information provided on the podcast should not be used for diagnosing or treating a health problem or disease. In no way should the information provided by OptoThrive be considered medical advice, and at all times the advice of a medical professional should supersede recommendations from OptoThrive. If you have or suspect you may have a health problem, you should consult your healthcare provider. The views expressed in this podcast are purely that of Dr. Sims and do not in any way reflect those of the institutions she contracts the medical services to.
Thank you for listening to OptoThrive. If you've enjoyed listening, please rate and share the podcast. You can visit our website at optothrive.com and leave a comment for any subjects you would like to hear more about.